Have you ever heard that newborn girls can have a period? Okay, not exactly. But this is one of the number one reasons new parents would call me into their hospital room after having their baby in a total panic. So here's what happens. While the baby is inside mom, growing, everything's going good, we have high levels of estrogen and progesterone. These hormones cross the placenta and enter the baby. They're super necessary for everything in the pregnancy to continue developing and for baby's development as well. But these high levels of hormones are basically shut off completely after birth because we are disconnected from mom. So when a baby girl is disconnected, the sudden decrease in these hormones triggers a response in the baby's body to kind of have a fake menstruation. And that's actually what it's called. You'll see the term false menses in relation to newborn baby girls having what looks like a kind of a period. So when you go to change a baby girl's diaper, if you see a little bit of pink or blood tinged discharge, don't freak out, this is totally normal. Usually we'll see this starting around day 2, maybe day 3, and it can last all the way up until day 10 after birth. Sometimes you'll even see just a white or clear discharge coming from newborn baby girls when you're changing their diaper. You don't have to do anything special, it's just a normal diaper change, clean as you normally would. And this, again, will disappear by around day 10. If you're still seeing the blood-tinged discharge past day 10 of life, that's something that you'd want to bring to your pediatrician's attention. So, speaking of hormones in newborns, did you know that it doesn't just affect baby girls? It can actually affect baby boys too. So here's what you'll see in a newborn baby boy in regards to the hormone fluctuations. So just like a baby girl, baby boys are also receiving a large amount of these pregnancy hormones while they're developing in mom. So the hormones that a baby boy is receiving from mom during pregnancy are also shut off after birth, and that also triggers a response, which can manifest as swollen testicles, which you'll see right after birth, and that will probably disappear just a few days after birth as the fluid kind of leaves their body. Or the swollen testicles can be caused just from the kind of fluid shifts that happen during the birth process and right at the end of pregnancy. There's a lot of fluid on board and you might see it in the testicles of your baby boy. If your newborn baby boy's testicles are remaining swollen past the first few days of life, that could be something you want to bring to your pediatrician's attention. This could be caused by something called a hydrocele or a hernia, and both of those are things you just want to discuss with your pediatrician because some of them might need more attention. You want to especially let your pediatrician know if you see swelling in just one testicle versus both. Another thing that you might notice in newborns, both baby girls and baby boys, caused by mom's hormones, is a swelling of the breast bud. You'll kind of notice in some babies it's way more pronounced than others, but you might notice a tiny little boob developing, and it's actually just swelling behind the nipple, and it's caused by, again, that extra dose of hormones that they were receiving towards the ends of pregnancy and during birth that have now been shut off, and there's a response triggered by the body, and that's the way that it manifests. This type of swelling around the breast bud caused by the hormones typically disappears around the second week of life. So that's everything you need to know about your newborn baby girl and baby boy and the possibility of swollen testicles and a period-like discharge. Those are the things you can look for, and just know that if you see those after birth, those are normal. Again, let your pediatrician know if you have any concerns. Thanks for watching, and I hope you subscribe to my channel for more baby tips like this.